We're joined now by Dr. Amesh Adalja. He's senior scholar at the Johns Hopkins Center for Health Security and an adjunct assistant professor at the Johns Hopkins Bloomberg School of Public Health. Doc, thank you for joining us. I mean, you've said, quote, "You have to think of the World Cup as a mass gathering event. It's going to be diseases of crowds, or what we call crowd diseases that spread." Okay, we've got Ebola, we've got screwworm, and now possibly an uptick in measles. What are you most worried about?
Of those three, it's measles that is actually a crowd disease. So it's going to be viruses like measles, COVID, RSV, influenza, norovirus, and then sexually transmitted infections, including Mpox. That's likely what we'll see an uptick of, not Ebola, not screwworm. This is going to be where people are interacting, so things have to be able to spread efficiently. And when it comes to Ebola, yes, it's deadly and scary, but it doesn't spread very efficiently from person to person.
Dr. Adalja, as we watch the news break from Africa about the spread of Ebola, this new strain in particular, there is this effort underway to develop a vaccine quickly to combat it. It makes me wonder about measles and why there isn't a treatment like that for measles yet. What explains that, and sort of where is the science on finding something that could be curative for measles?
So measles is something that is an acute infectious disease, that it has an incubation period. You get sick and then most people will recover, although 1 in 5 may end up hospitalized. People may end up with pneumonia, and there are severe complications and deaths that occur. We just don't have an antiviral that works very quickly in that early stage. There is work being done, but it hadn't really been something that we had to think about because we have a safe and effective vaccine that has been around for almost like 70 years. And that's really decrease the burden of measles in most places. And it's been the vaccine that's been seen as the solution. But now, as the anti-vaccine movement has made major inroads and people are turning away from the vaccine, now there is renewed interest in thinking about antiviral therapies to prevent the severe complications of measles. But the thing is, you're going to have to get that to people very quickly. And we don't have a rapid diagnostic test for measles. So it's going to be a logistical challenge, even if we get an antiviral for measles. The vaccine remains the best way to control measles, though.
I do want to dig into these measles numbers a little bit, because as I was reading up on this, I didn't realize that the U.S. is about to lose its status under the World Health Organization as a measles-free destination. It's been declared measles-free twice already, and it has to essentially prove its case. The U.S. asked for more time. It was supposed to be about now. They're going to do it in November. But according to the study in the Lancet, the number of cases and the genetics of them far exceed the usual threshold for being able to declare yourself a measles-free destination. Do you think this is kind of a fait accompli and the U.S. is going to lose this status in the fall?
Yes, it would have been removed earlier if they wouldn't have moved this until after the election. But yes, I think that measles elimination status is gone in the United States. And if you look at any of the benchmarks of a measles eliminated country, the U.S. is not meeting any of them. And irrespective of that, we can't control measles. We have over 2,000 cases in the United States. We've had deaths last year from measles. This is not something that the U.S. has the wherewithal to control anymore because people have turned away from the actual solution, the vaccine. So yes, I think this is an embarrassment that we will lose elimination status. And I think that it really is going to take a lot of hard work to regain that measles elimination status.
What do we know from an epidemiological perspective of how the U.S. government, I guess the Canadian government, the Mexican government is thinking about spread of measles, other illnesses at the World Cup? Is it something that you think there's been enough attention paid to?
Do they have contact tracing teams at these events?
How much is that something that's part and parcel with a major event like this one?
It's definitely been something incorporated very early on, where the host cities were looking at their public health preparedness, their hospital preparedness, thinking about what early warning systems they need to have in place, how they might deal with healthcare surge from infectious disease and from other events. There are places doing very innovative stuff by looking at genomic data, like from wastewater monitoring to see which viruses are high in the wastewater in a given place. There are people looking at social media posts to see are people getting sick, and they're integrating all of that together. So each city is doing it a little bit differently. There's some interesting work being done in Toronto. There's been interesting work done at Georgetown that's monitoring multiple cities. So there is a lot of innovation going on, trying to integrate kind of that whole radar that we have around these. And some cities are going to be more prepared than others. But I think when you have mass gathering events occurring, this is kind of how you do it. You have to expect that you're going to see upticks of crowd diseases and other healthcare needs, and you have to prepare proactively, or you really won't be prepared.
I also want to ask, I mean, it does seem like measles and is the bigger concern for World Cup, but I want to ask you about the status of this screwworm outbreak in cattle. You've got 9 cases currently reported. The FDA has issued an emergency authorization for screwworm treatment for dogs and cats. Is that likely to spread through, our family pets? And how do you stop this spread? Is it difficult?
It is difficult because the screwworm is basically the larva of a fly, the screwworm fly. And yes, it can infect domestic pets. That's not the main thing we worry about, though. It's mostly domestic cattle, because that has major implications for the economy of the beef trade. And we've already seen Canada ban imports from Texas cattle. The way that you control this is really by reducing that fly population. And that involves releasing sterile flies. These are flies that have been genetically modified. They've been irradiated, they're sterile, they go out there and they mate, and the larva, or they're not able to have viable offspring, and the population goes down. That's the tried and true way of controlling screwworm. But it is very difficult to do, and it's going to take some time. And that the number of cases, 9, is probably bigger than that, because some of those animals are hundreds of miles apart. So you have to really assume that it's in a wider swath of Texas, and it's going to take some time to actually get countermeasures in place.
I want to ask you lastly just about Ebola, I suppose the hantavirus as well. These are, I guess you could say, test cases for if there were an outbreak of a different virus or illness that spread more widely or could spread more quickly over a wider swath of territory. We've spoken with Tom Frieden, the former CDC director. We've spoken with Jeremy Conondike about Ebola and his work in Africa during the 2014-2015 outbreak there. How do you gauge the capacity of the U.S. and international health organizations to respond to outbreaks more generally based on what we've seen with the hantavirus and with this latest strain of Ebola?
I don't think it's very good. What you want is a proactive response where you're getting in at the earliest possible juncture with flooding the zone with lots of resources to be able to extinguish these things early. So with hantavirus, that was a little bit of a curveball because we had not seen that on a ship before. It was a version that spreads person to person. But what you saw was the CDC being very late to the game. Then you saw kind of conflicting policies relating to the quarantine in Nebraska and home monitoring and how that was all going to work. With Ebola, this virus had a several week to maybe months head start. Initial diagnostic tests didn't pick up this species of Ebola. And what you've also seen is really mixed policy from the U.S. Are they going to make a hospital in Kenya to take care of Americans? Why aren't we using our Ebola treatment units in the United States? All of that doesn't portend for good pandemic coordination if there were something more contagious. We don't have a CDC director. CDC has basically been decimated, a shadow of what it once was. So all of this does play on our resiliency to infectious disease threats. And if this was a stress test, the U.S. didn't really pass that stress test very well.